Before you start taking Tracleer, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually twice daily in the morning and evening. The dosage will depend on your medical condition, weight, response to treatment, and other medications you may be taking. Your doctor may start you on a lower dose and then increase it after several weeks. It's important to use this medication regularly to get the most benefit from it, so try to take it at the same times each day. Do not stop taking Tracleer without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. If you're pregnant or may become pregnant, avoid handling the tablets or breathing the dust from this medication. And be sure to tell your doctor if your condition lasts or gets worse. Some common side effects of Tracleer include dizziness, flushing, stuffy nose, or joint pain. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's essential to contact your doctor immediately if you experience any serious side effects, such as a fast or pounding heartbeat, unusual tiredness, swelling of the ankles or feet, sudden weight gain, fainting, shortness of breath, or coughing up blood. In men, Tracleer may decrease sperm production, potentially affecting the ability to father a child. It's important to discuss this with your doctor for more information. Although rare, a very serious allergic reaction to this drug may occur. Seek immediate medical help if you experience symptoms such as fever, swollen lymph nodes, rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Tracleer, make sure to inform your doctor if you have any allergies or if you have a history of liver disease or anemia. This medication can cause dizziness, so it's important to avoid alcohol or marijuana, which can make this dizziness worse. It's also important to avoid driving or using machinery until you know how this medication affects you. Before having any surgery, let your doctor or dentist know about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. Tracleer should not be used during pregnancy, as it may harm the unborn baby. It's important to use reliable forms of birth control while taking this medication to prevent pregnancy. If you become pregnant while taking Tracleer, let your doctor know immediately. It's also unknown if this medication passes into breast milk, so it's best to consult your doctor before breastfeeding while using Tracleer. When taking Tracleer, it's important to be aware of any potential drug interactions. Make sure to keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. This will help them ensure that there are no interactions that could affect how Tracleer works. One medication that may interact with Tracleer is sparsentan. Additionally, other medications can affect the removal of Tracleer from your body, which may in turn affect how Tracleer works. It's important to discuss with your doctor any other medications you are taking to ensure there are no negative interactions. It's also important to note that Tracleer may decrease the effectiveness of hormonal birth control such as pills, patch, or ring, potentially causing pregnancy. If you are taking Tracleer, it's important to discuss with your doctor about using an additional reliable birth control method to prevent pregnancy. As always, it's important to follow your doctor's recommendations and not start, stop, or change the dosage of any medicines without their approval. This will help ensure that you are using Tracleer safely and effectively. If someone has taken too much Tracleer and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. Overdose symptoms can include severe headache, severe dizziness, nausea, and vomiting. If you are in the US, you can call your local poison control center at 1-800-222-1222, and if you are in Canada, you can call a provincial poison control center. Remember, it's important not to share Tracleer with others. Before starting Tracleer, your doctor may want to perform some lab or medical tests, like checking your liver function, doing pregnancy tests, and monitoring your hemoglobin and hematocrit levels. It's crucial to keep all your scheduled medical and lab appointments and consult your doctor for more information about these tests. If you forget to take a dose of Tracleer, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. It is important to store Tracleer at room temperature and away from light and moisture. Make sure to keep it in a place that is out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. When Tracleer is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.